This repositioning procedure is to be used when a patient needs to be moved to the side of the bed and when no mechanical lifts are available. A low-friction draw sheet should be positioned on the bed prior to the movement, that is, when the bed is being made. There should be 2 trained caregivers performing the procedure, and there must be sufficient room at the head of the bed for the caregivers to move. Explain the procedure to the patient. Lower the head of the bed and ensure that the bed brakes are locked. Lower the side rail on the same side of the bed that the caregivers are standing on. Untuck the draw sheet. The side rail opposite to the caregivers remains up for patient safety. Adjust the height of the bed to the upper thigh level of the shortest caregiver. The caregivers stand on the same side of the bed, one positioned in line with the patient's shoulder and the other positioned in line with the patient's hip. Remove the pillow from under the patient's head and place at the head of the bed. Remove the footboard and move the patient's legs towards the edge of the bed using a side-to-side weight shift. Ask the patient to lift her head off the bed by tucking her chin into her chest. Hold the side of the draw sheet using a palms-up grip. Avoid using a palms-down grip. Ensure that your elbows are held tightly against the sides of your body. Stagger your feet forward and back. Bend your knees and place your weight on the foot that is nearest to the bed. Prepare to perform a front-to-back weight shift. Ensure that the draw sheet is slightly taut prior to the movement by leaning backward slightly. Choose a leader to count 1, 2, 3, move.
1, 2,
On the designated count, the caregivers slide the patient by shifting their weight from their front leg to their back leg while keeping their elbows close to their body. Avoid pulling with your arms.
1,
If the patient is not repositioned far enough, repeat the preceding steps as required to bring the patient toward the side of the bed. Readjust the pillow under the patient's head. Tuck the draw sheet in and raise the side rails. In summary, this procedure should be used to reposition a patient to one side of the bed if a mechanical lift and repositioning sling are not available. Both caregivers should be trained. A front-to-back weight shift should be used to slide the patient along the bed. There should be no lifting.